Okay. I'd like to welcome everyone to this meeting. First public meeting of the Broxtowe Save Our NHS campaign, which has been set up under the auspices of the Nottingham Trades Union Council. My name's Liam Conway. I'm the president of Nottinghamshire Trades Union Council, and I'll welcome you all here tonight. Obviously, this is a very, very big issue, and one which there's still plenty more to play for, even if the Health and Social Care Act, misnomer if ever there was one, has actually become law. We've got a number of speakers tonight, and I'll introduce them at the time. Just a few opening remarks. I've got a lot of admiration for the man who was first behind the NHS. That's Nye Bevan MP. Now, I don't have a lot in common really with Nye Bevan. He was Welsh and I'm Irish. He was a little bit older than me. He was a Labour cabinet minister, and I unfortunately have been expelled from the Labour Party. So I don't have that much in common with him on those sorts of personal fronts. Not that I know much about his personal life. But what I do have in common with Nye, and it's a quote that goes around the Facebook sites and Twitter regularly, and that is a seething hatred of the Tory party and every single thing that they stand for and ever stood for and ever will stand for. And what the Tory party is, and it's largely the Tories, of course, is behind the Health and Social Care Act, despite their little kind of mini-me's in the Liberal Democratic Party. It's the Tories that are behind the Health and Social Care Act. I think it's really good that at the Labour Party conference, they made a commitment to repeal that act and to scrap it. I'd like to see Labour go a bit further than that and promise to reverse all of the cuts and in the health service and to bring all parts of the health service back into public control where it belongs, where it started when Nye Bevan helped to set it up. Because what we're seeing here in what's happening with the health service is morally wrong. It's just a clean issue of what's right and wrong, and what we're seeing is completely wrong. And what it does is it risks the health and lives of actually millions of people, millions of the most vulnerable people in our society. We see in America what a privatized health service can do, and you get in America, along with many, many other things, you get situations where people with pre-existing conditions are not entitled to health care, where people think they're covered by insurance and then find that they're not covered and end up dying painful deaths or being denied life-saving treatment. So we don't want that sort of healthcare system in Britain, and the American people shouldn't have to put up with there either. I think it's important to support workers in the health service who are fighting against cuts, that campaigns spread to support those people, and that we help those to return the health service to full public ownership. Now, I'm sure there are nurses and doctors and others here tonight who work in the health service. And it's my view that we shouldn't be handing the health service over to private sector sharks. What we should be doing is strengthening the role of the people who work in our health service and the people that use our health service. Our health service should be run by a combination of the workers that work in it and the people that use it. And then we'd get a fully democratic health service, which is what we should all have. Okay, let's go on to speakers. The first speaker we've got tonight is a health service worker, Sharon Vasselin, who's the Assistant Branch Secretary of UNISON at Nottingham University Hospital. Round of applause for Sharon, please. Sharon.
Good evening. Can everybody hear me? I'm not used to microphones. It might sound a bit reedy, so I do apologise, but there's so much to go through, so I do apologise if it sounds like I'm reading everything. The new NHS Act has caused a lot of controversy since the release of the original white paper entitled Equity and Excellence, the Liberating of NHS, on 12th of July 2010. This was published only 2 months after the general election, contradicting the promises made by Cameron and Clegg to keep the NHS public. Upon browsing this paper, I realised that the word equity did not meet the dictionary definition. The proposals would create a greater divide between those who have and those who don't have anything. As for liberating, I think it meant from the hands and the accountability of the people to the private sector. Despite mass opposition from doctors, nurses, NHS support workers, unions and the general public, including a lame exercise in listening, the government delayed closing Parliament in order to get the bill through. The bill became an Act of Parliament in March 2012, a black day for the people of the UK. So why were the government intent on passing this Act? It may have something to do with the mass donations to the Tory party from healthcare companies who want a piece of the NHS. If you want to know more about this, check out the Channel 4 news article, for example, dated the 29th of August, entitled Public Sector Outsourcing the Political Connections, which states Care UK, which is a private healthcare company, were bought out by Bridgewater Private Equity, which counts among its advisors former chair of the Conservative Party and current chair of the BBC Trust, Lord Patten, as well as former Health Secretary under Labour, Alan Milburn. This also explains why there appears to be a media blackout, particularly with the BBC, about the privatisation of the NHS. Another article from Social Investigations Online states that Andrew Lansley, the former health minister, received a donation from John Nash, the chairman of Care UK, who gave $21,000 to fund Lansley's personal office in November 2009. So what about the rising cost of the NHS, which we're told is a burden to the state? We're told this Act was put into place due to the rising cost of the NHS, its bureaucracy and an ageing population. But what this government fails to tell its people is that our NHS was one of the most cost-effective health systems in the developed world. This was stated in a Guardian article dated the 7th of August 2011. The article says the NHS is saving more lives for each pound spent as a proportion of national wealth than any other country apart from Ireland over 25 years. Among the 17 countries considered, the United States healthcare system was among the least effective and efficient. So what about the debt the NHS is currently in? The NHS has to find $20 billion over the next 5 years, coincidentally roughly the same figure as an amount lost due to an IT scheme that failed, an IT system that was being developed in the private sector. Some of the debt is also down to the private sector that is already in the healthcare service via the development of treatment centres and private finance initiatives, which I'll go into detail later. So how is the NHS being privatised? There are a few ways that the NHS is being privatised. I've included those that mainly affect secondary care, which is a sector I work in, but I'm sure there's others that are infiltrating into the NHS. And the ones I was going to talk about were care commissioning groups, which are made up of your GPs, treatment centres, foundation trusts, private finance initiatives. So we look at care commissioning groups. These groups will receive the majority of the NHS budget to buy health services. Any qualified provider can bid for these services, including NHS organisations and private companies. GPs will be asked to look at the cost-effective bids. The majority are not trained to set up service-level agreements, and many have made it clear they don't want to be involved. However, if the care commission groups are not run effectively by GPs, the new Health Act will allow the private sector to take over completely. Treatment centres. Treatment centres were brought in by Labour to provide additional resources to the health service. However, they are at least part, if not all, privately owned. Locally, we have a treatment centre at QMC, which is partly owned by Circle, who, as you heard earlier, make donations to Tory MPs. Circle also owns the first privately run ex-NHS hospital in the country, Hinchbrook. At present, the services for the whole of Nottingham Treatment Centre are under a bidding process, of which Circle, Care UK and our local NHS are amongst the bidders. Interestingly, according to Dr. Owen Clark's blog, The Green Benches, he lists 9 causes for concern since Circle privatised Hinchbrook. Some of these include 18.7% increase in complaints, 50% increase in staff sickness absence, a breach of a 28-day target for seeing patients with suspected testicular cancer over the last quarter, agency spend of £400,000 for 10 temporary staff, failing to meet its budget deficit by £250,000. In the first 3 months, it overspent by £2.5 million. Sacking 47 staff nurses, saying they were overstaffed, but told a coroner recently they were boosting nursing staff because of shortages. Do we really want this company running our local health services? Foundation trusts. Hospitals have to become foundation trusts under the new legislation. Foundation trusts can borrow from the private sector, retain their surpluses, keep hold of all their money from the sale of land and assets, and exercise a greater degree of discretion on pay than other NHS hospitals. In order to gain foundation status, trusts should make sure they're in profit. Mid Staffordshire NHS Trust had not long gained foundation trust status when there was a major national inquiry into its mortality rates. Interestingly, one of our union representatives discovered in late 2009 that according to Dr. Foster, which is our national statistic website on the NHS, that 9 out of the top trusts with the highest mortality rates were foundation trusts, and the 10th was going for foundation trust status. And private finance initiative. Private finance initiative is like a second mortgage, where in exchange for a private company providing a building and services, the NHS Trust pay this back via rent over a time period of 30 to 60 years. QMC, ENT and ophthalmology is a PFI. So how does privatising the NHS affect its patients? The NHS was a non-profit organisation. I say was because it's breaking up before our very eyes. I.e. it was based on local need rather than how much money it can make. As part of this, most services needed by the public are available. Losses made from one trust or service were balanced out by profits from other trusts or services. However, the private sector cannot function without making a profit. Therefore, they will only provide services that are lucrative. Inevitably, this means those with costly illnesses will find it harder and harder to find their service and will either have to travel further or pay out. There will be less places for student doctors and surgeons to train in this specialty, hence an increase in healthcare becoming a postcode lottery. This is why you'll find treatment centres tend to only provide services that are less complex, leaving the NHS services to mop up the remaining demands at a loss, i.e. creating a debt to the NHS. Despite these advantages in the private sector, UNISON stated in a recent paper entitled Empty Promises, for independent treatment centres, those are the totally privately run, the Healthcare Commission in 2007 observed that the emergency readmission rates for hip replacements were similar to the NHS rates, but said that this was perhaps unexpected, given the mix of patients treated, which excluded those with the most complex needs. Therefore, even treating simple cases did not give them advantage on readmission rates. The focus of a foundation trust has to be on cost, because there is a requirement to make a surplus, i.e. profit, to reinvest in services and compete with the private sector. They can only borrow money from the private sector at significant interest, whereas before it was via social funds with minimal interest. Therefore, if a trust finds itself in debt, it will have to make further cuts or treat more private patients in order to meet the payments plus interest. This means those services that are not lucrative will probably be cut in order to survive in a competitive market. There is no requirement for a foundation trust to adhere to staff terms and conditions. There is a likelihood of pay cuts and job losses in order to achieve this surplus. This could lead to a reduction in skill mix and downgrading of posts, i.e. a less skilled workforce. Previously, foundation trusts could gain finances by treating private patients. However, there is a limit of 5% to that. Under the new Health Act, this has been raised to 49%. Private patients will inevitably be privatised for reasons mentioned previously. The outcome of this? A longer and longer waiting list for NHS patients, if they're to be seen at all, as private patients leapfrog to the front. Patients who are probably already in extreme pain. Finally, if foundation trusts fail, private companies can take over. Can you see a theme here? Nottingham University NHS Trust, which includes Queen's, City and Rote Walk, are applying for foundation trust status at the moment, along with Nottinghamshire Healthcare, which covers the surrounding NHS services in Nottingham. The competitiveness of the private sector does not sit well with running an NHS service. Many patients have multiple health problems that require communication and assistance between services, what we call a patient pathway. NHS providers are constantly trying to improve this process. Where without this, patients could find vital information about their health is not being passed on to the next healthcare provider, and this could have serious consequences. Being a government body in the NHS has public accountability. There are many measures within health to ensure that care and safety is of the highest standard. A government body is under the Freedom of Information Act in terms of providing the public with any relevant data upon request. The private sector is not. How do we know our healthcare in the private sector is of a safe and high standard? Where is the accountability? So where is the health service going? As for where the health service is going at the moment, then you only need to look at the Michael Moore film Sicko. Some of you may have seen it, some may not, and about the US health system, and to talk to someone who remembers it before 1948. In Sicko, we see patients having drips removed and put into the street because they only have to be treated critically and have no health insurance. For those who do have insurance, a girl with a fever is not treated by a hospital because she is not insured at that one and dies en route getting to the right one. An elderly husband and wife, one who has cancer, the other heart problems, who worked all their life because of their illnesses, they are now uninsurable. They now live in a spare room at their daughter's house as they had to sell theirs to pay for their healthcare. This is people that had insurance. But make no bones about it, to quote, bit of a pun, people are going to die as a result of this new Health Act, or they're going to suffer for a long, long time. And I'll leave it there. I've got some things about what we can do about that, but I'll leave that to come back at. Yeah, thank you.
Thanks a lot, Sharon. I am a little bit anxious that Nick Palmer is that far away from my 5-minute warning, but we'll deal with that when we get to it. Okay, the next speaker is Anne Pridmore, who is from the Independent Living Fund, and she's going to speak a little bit about issues that are going on there and relate that to the health service. Anne Pridmore.
Thank you. Hi, I've got a confession to make to you first of all. I thought I was coming here to speak about the demise of the Independent Living Fund, and seemingly I'm going to be talking about privatisation of the NHS, but it is quite relevant. I have had a care package since 1989, which was made up from the local authority and a trust fund called the Independent Living Fund. At the end of 2014, the Department of Work and Pensions has decided to end that trust. So that means that half my package will go. So the only future for me is to go into some old people's residential home, not something I thought I'd be doing after all the years I've done campaigning for disabled people. Now, how does the privatisation of the NHS affect disabled people? It affects them because, in the first place, someone like myself, although I have a condition called cerebral palsy, it has absolutely no effect on my health. In fact, for 73 years of age, I've got a very good record for health. But that won't make any difference when people decide to limit health for people who can't pay. I've had some really quite bad experiences when I've been in hospital. This is actually under the NHS, so goodness knows what would happen if we had no NHS. I'll give you a few examples. 3 years ago, I had an accident on my left femur, and I had a hematoma that was terrible. I went daily to the NHS hospital, and I couldn't. It seemed like because I was disabled, it didn't really matter. And I spent 6 months going backwards and forwards till I could see for myself that if I didn't do something, then I was going to get gangrene. By this time, I'd got MRSA. So goodness knows what would happen if there was no national health for some disabled people. I actually paid privately to have a skin graft, but because I couldn't afford the anaesthetic, I had to have it done without anaesthetic. Going back to the Independent Living Fund and how it will affect disabled people who have to spend time in hospitals, it will affect them because we all know that the NHS workers are stretched to the limit. Someone like myself or many disabled people going into hospital, they just haven't got the amount of staff they need to cope with them. So on the odd occasions when I've been in hospital, when I broke my leg and when I was going because of my skin graft, I used to ask my PAs to come into hospital, personal assistants, some people call them carers, to do their shift in the hospital, because otherwise I wouldn't get my dinner or the attention that I needed to get well. The ever-present fear of disabled people and the new pathway to life, I think it's more the pathway to death myself, is that if you're not fit, if you're disabled and you're seen as someone worthless, they're not going to survive to keep you alive, and that will be increasingly so once the NHS gets privatised. Several of my friends have had do not resuscitate put over their bed. One person who's in the House of Lords, her partner came along and saw it, and they said to him, well, if she comes round from this, she'll have to be on a life support machine. To which he said, well, Jane would prefer to be on a life support machine and carry on her life. She doesn't want to be dead. And this is the fear I have about privatising the NHS. Also, if you privatise the NHS, the majority of disabled people in this country, of which there are 10.1 million people, will never be able to afford the insurance that they have to pay. Lots of those people, I should think it's about 74% of those people, will not be in work. So how are they going to pay for medical attention? They can't do that. And we've seen what this government is doing to disabled people by selling out to private enterprises such as Atos, who have got contracts for £400 million in order to carry out work capability assessments. 73 disabled people a week are dying because they're so frightened of these assessments. They're either dying because they've had strokes, there was another one this week, or else they're committing suicide because they're so frightened they're going to lose their benefit. How will they cope with a privatised NHS service? They won't.
Okay, thanks very much. That's absolutely brilliant. Thanks a lot, Anne. Okay, our next speaker is the former MP for Broxtowe, former Labour MP for Broxtowe, Nick Palmer. Nick Palmer was incredibly sadly and unfortunately replaced as an MP by Anna Soubry, one of the most vicious Tories around, a Tory that believes building a dual carriageway between Nottingham and the motorway called the A453 is more important than funding healthcare, and a Tory that believes that there's no problem with cutting the pensions of public sector workers and all other workers, but there is a problem, as she told me in an interview on the radio not very long ago, with reviewing the pensions of MPs. I'd reviewed their expenses, particularly in the light of the McShane scandal today. But Nick Palmer, it's great to have you here tonight. One thing I know that was said to me before this meeting started is that one thing that should be the case at the time of the next election in Broxtowe is that we should make the election a referendum on the NHS. The candidates that fully support the NHS and fully support it being brought back into public ownership against those that would support what's going on now, the privatisation of it. So, Nick, if you are that candidate, I hope you're going to be standing on that sort of platform. Nick Palmer.
Thank you very much. I'm just going to experiment. Is that better? No, that's better. Yes. Yeah, I mean, to be fair to Anna Soubry, she has been speaking out fiercely on the subject of health recently. She denounced large croissants and large cakes in last week's Daily Mail. So got the priorities there. But when I was first elected back in 1997, at that stage, formally, we had a perfectly good NHS, but in reality, we had a complete two-tier system. And many of the constituents who came to see me told me that they were given a very clear choice. If they wanted treatment for some non-emergency condition, like a hip replacement, they had a choice of waiting 2 years to get a new hip, 2 years in real pain, real difficulty, not able to get around, or the very same consultant would arrange for it to be done privately within 2 months. And I heard this again and again, and we're a fairly prosperous area in many cases, and many people felt that if they used up their savings, they could perhaps manage to go private, but then they were afraid what happens if the operation doesn't go quite as it should. Maybe I'll have to have another operation. I can't afford that. And even in an area like this, people were just scared. And that's a betrayal of the whole principle on which the NHS was set up. During the time after 1997, for all the faults that we're aware of the Labour government, which some of which I've admitted and some we can argue about, the amount of money and the amount of effort that was put into the NHS brought about a transformation so that for normal conditions, not emergency conditions, but the conditions that all of us can have at any time, the waiting time came down to the point that we were talking about a maximum of 18 weeks between when you first went to a GP to report it to when you got your operation. And the effect of that, I looked at the figures in Parliament at the time, the effect of that was that the private companies found that they were losing business. Fewer and fewer people were actually taking private insurance because they felt that the NHS was doing a good job for them. And the result of that was that the support for the NHS spread and extended to the point that even the Conservative Party felt unable to challenge it. And that's why before the election, we got the promises of no major top-down reorganisation and that the NHS would be safe in the government's hands. Now, I don't want to go over the same ground that you've already heard so passionately from my fellow speakers, but there is a triple privatisation in progress. On the one hand, we're seeing the privatisation of provision, and it's important to keep these three things separate. Privatisation of provision is that private companies are being pushed into the foreground of the providers of healthcare to the NHS. This has existed for a long time, but what's happening now is firstly that the tariffs are loaded in favour of the kind of work that private companies like to do, which is the easy work which requires relatively limited resources and which you don't need a big general hospital for. And that's where the profit is to be made. By contrast, if you want to have a complex operation, open heart surgery or whatever, then the money that the NHS will provide doesn't cover the cost. Now, the way the NHS balances the books is that it gets the money for the elective simple operations and uses that to subsidise the complex ones. Because the private companies are being encouraged to bid for the simple operations, they are sucking away from the NHS the basis to do the more complex work. Is the private sector interested in doing the complex work? No, they're not. They're not interested because there isn't enough money in it. So what we're going to see, and this is the point that Sharon was making, that what we're going to see is more and more small private companies bidding to mend broken ankles and do minor operations and making significant sums of money on that, while the major NHS trusts, like the main Nottingham trusts, are going to struggle. The more they struggle, the more they will be under pressure to outsource and to retreat from the major provision of care, because that will be done at a low undercut rate by the private sector. That's one privatisation, the privatisation of provision. The second privatisation is the privatisation of the patients, because hospitals, as Sharon was saying, are now being encouraged to have up to 49% of their capacity by paying patients. Patients who pay for care instead of going through the NHS. Now, if we had Anna Soubry here, and I wish we had, because we've got an MP who's a health minister, it's a pity she's not willing to come and defend the case. But if we had her here, what she'd say to that is every penny of that money will be ploughed back into the NHS. Now, suppose that you're an NHS hospital manager. You make a profit from expanding the number of private patients from, let's say, 5%, 15%. What do you do with that profit? You've got to plough it back. But if you're being measured on the bottom line, and you are being measured on the bottom line, what you're going to do is build a new wing for paying patients, because that's the way that you will keep pushing up your profit. So we will see an automatic ratchet effect that more and more hospital provision is provided to people who are willing to pay for it. The more that happens, the greater the differential will be between people who can pay and people who depend on the NHS. And we will get back to the situation in 1997 where you've got a choice between paying your life savings or waiting for 2 years or longer. The final privatisation is one that I haven't heard referred to much, but it's a little known fact that the CCGs have one big change in the requirements of what they're expected to do. They are not responsible for preventive health care. And the effect of that is that it's landing on the local authorities. Now, local authorities are not subject to the guarantee of funding for the NHS. The local authorities are being strangled financially. They cannot possibly afford to start major new preventive health care campaigns. And that's fatal for any sensible health system, because right back when the NHS was founded, Nye Bevan made the point that the health system is not just about treating you when you're ill, it's about helping you not to become ill. And that's cheaper for the health service, and it's better for us. And by saying this is no longer an NHS job, this is something local authorities have to worry about, what we're going to find is that a huge patchwork, a postcode lottery across the country, some parts of the country where public health and health prevention is taken seriously, and some parts where it frankly isn't, and where the long-term effect is that more and more people fall ill when they wouldn't otherwise have done it. And that's shameful, and when we talk about the end of the NHS that we know it, it sounds like rhetoric. But it's actually true that what we're faced with is a separation between the emergency and the genuine long-term commitment to health, which we all depend on. Now, I was asked to say that if I was the MP next time, that I'd be in favour of bringing these things back. I think we need to be clear on this. 2 minutes, it says. Soon be finished. We need to be clear what we're promising and what we're not promising. And as you know, the Labour Party has taken a vow of omerta, not to say anything about what we're promising until close to 2015. But I'm not an official candidate at this stage. I'm not bound by that. I think that we should say quite clearly, we're not going to reorganise the whole damn thing again. We're not going to reinvent the PCTs, because that's not the element of privatisation that we're talking about. But what we need to say quite clearly is we will put an end to this pressure on hospital managers to open up to more and more paying patients, and we will introduce a presumption against using private providers where it's possible to use a public provider, because only if we put in those two criteria can we reverse the trend which will otherwise persist into the future, and we will then genuinely lose our health service. I think that every candidate who wants to stand next election needs to make that kind of commitment, and we need to be clear when we're talking to health service workers, but also to the general public, that we want to preserve what's best in the health service, and we want to make sure that it returns to being a service for all of us. Thank you.
Thanks very much, Nick. One thing that Nick did say there is about how Labour doesn't make any commitments because it doesn't know what the situation is going to be like at the time of the election. Well, one thing we do know what's going to be the case at the time of the election, and that is that the rich will be still extremely rich, and they will still be creaming off huge amounts of profit at the expense of the rest of us, and that surplus wealth should be extracted from them in large amounts and used for health services, used for education, used for all the things that ordinary people like people in this room need. So I think we know something about what the economic situation is going to be at the time of the next election, which is only about 2.5, 3 years away. Okay, one thing that Nick did say also that I do tend to agree with is the issue about prevention. My brother works in the health promotion unit in Nottinghamshire and has done for years. And as soon as the Tories came to power, that service in Nottingham was absolutely decimated. It actually led my brother to be off work for about 6 months with stress because of the fact that so many of his fellow workers had simply been paid off and told to go away. And the service that they were providing, advice to schools about preventative health that Nick talked about, are absolutely vital services for ordinary people to make sure that they can prevent the sort of health problems that we get in old age and other times of our life. Right, the last speaker is a medic, is Arun Chopra, who is a consultant psychiatrist from the QMC. Now, whilst I've been, sitting listening to the other speaker, I have taken the opportunity to text Arun's department, and I've made appointments there at his department for David Cameron, George Osborne, Jeremy Hunt, and Andrew Lansley. And because I'm in education, I also took the opportunity, although it's not strictly health, to make an appointment for Michael Gove. So they'll be turning up for you to sort out, because they're clearly clinically deranged and they need sorting. Arun Chopra from the Health Service.
Thank you very much. I'm not sure that I'd want to treat them. First of all, I'd like to say a few thank yous. I'd like to say thank you to Broxtowe Save Our NHS, because I think you're doing, I know this is your first meeting, I think it's an issue of such great importance, and I'm so happy to see something like this being set up. I'd also like to say thanks to the previous speakers, because you've made one for such articulate, passionate speeches, but also because you've discussed most of the points that I was going to discuss, so you've made my life a lot easier. And finally, I'd like to say thanks to all the people who've come here today. I know it's cold, it's Friday evening, and there are so many other things that people need to do. So I'm always humbled when I come to speak at events around the NHS that so many people come out to support the NHS and to find out what's going on. Because one of the things which I've realised is that most people don't understand the degree of threat and the severity of the threat to the NHS. So I'm really pleased that you've all come, and thank you. this afternoon, whilst I was jotting down the points that I was going to talk about, I was reminded of the fact that I have been speaking about the NHS in the run-up to the campaign to try and get the Tories and the Liberal Democrats to drop the bill. And I wondered whether I could just rehash some of the stuff which I've spoken about before. But I couldn't. One, because we're a year and a half on, and there is so much more data and so much more information about what's happened in the last year and a half that I think it's more important to share. And so I'm going to kind of focus on what's happening from a clinician's perspective. You're quite right to say that I'm from the Queen's Medical Centre, and I'm a consultant psychiatrist with Notts Healthcare NHS Trust. I'm also an honorary lecturer with the University of Nottingham, but what I'm saying today is not from any of these organisations. It's my view, and I have to say that because sometimes I can get myself in trouble. So I'm going to, the NHS is such an important thing. It's not just about a system of care. It's a statement of our social solidarity. But I'm not going to talk about the rhetoric. I'm going to come straight to the facts. And Nick actually started talking about one of the issues around how the NHS has improved since when Labour came to power. There's a survey called the British Social Attitude Survey, which has been running since 1983. And it looks at, one of the questions on it is public attitude to the NHS. And every year since 2001, the satisfaction ratings with the NHS went up and up and up. And it continued to go up all the way up to 2010, when the coalition came in. At the point when the coalition came in, NHS satisfaction ratings was at 70%. That's an all-time high, and I think the thanks has to go to what Labour did. I was a junior doctor under Labour. I became a consultant just when the coalition came into power. And as soon as the coalition came into power, NHS satisfaction rating fell by 12% just in a year. So as soon as they came in, satisfaction went with the NHS. And cynics said that this is because of Labour supporters saying that things have got worse. Well, actually, they did the analysis. They looked at it across the political spectrum. Tory voters, Liberal Dems, Labour voters, everyone felt that the NHS had got worse. Now, what I'd like to do now is actually think about a few of the reasons why the NHS has got worse from my perspective. And first is I think that clinicians like myself and NHS managers and people in leadership roles have had to take their eye off the ball of patient care. And that's because we've been tasked with saving £20 billion. It's an unprecedented level of savings which the DH has asked us to make. And at the same time of making these savings, they've also heaped upon us, the biggest structural reorganisation that the NHS has ever seen. The Act which went through Parliament is actually longer than the Act that was needed to create the NHS in the first place. And the scale of the reorganisation and the fact that we're having to make these savings has just left clinicians taking their attention from what we should be doing, which is purely patient care, and having to understand the new way in which we're supposed to be working and our new managers and our new bosses. The second reason why I think the NHS has got worse and why the public is saying so is because services are being cut. It really angers me every time David Cameron stands at that dispatch box and says, we've made a pledge to make sure that the NHS saving is the same. That's absolute crap. I'm afraid it's a lie. If you look at the DH website, the area I work in mental health has had a severe cut. There's no two ways about it. And when you think about the biggest cost to the NHS is the staff, 80% of the budget goes on staffing, it is inevitable that people have lost their jobs. I know that in mental health trusts across the country, there is one trust, I was talking to one of my colleagues about it just now, that lost 500 CPNs. And when that happens, it has a knock-on effect on patients. So I think that's another reason why things have got worse. And then I think, thirdly, I think this factor has to be mentioned, is morale in the NHS staff. I was at a meeting earlier today where they were talking about whether doctors and nurses are altruistic in the NHS, and I got really angry. I said, of course we are. But people who work in the NHS generally go the extra mile. And I think what's happening, though, is the coalition have put this set of reforms and set of things which they've done to us that's actually really tested our faith in the model that we work in. I mean, the things like the pension changes, the pay freeze, which is actually a pay cut when you look at inflation, and this idea about having a regional pay deal, this is diabolical, and it is really hurting NHS staff. It makes us angry. I'm going to come back to the Act. I mean, there's some of the reasons why I think things have got worse. Many of the points have already been made, but I think I have to make a non-partisan point. I'm a member of the party, but I'm going to make a non-partisan point. Some of the stuff that Lansley said was not actually wrong. There were bits of this which I actually, as a clinician, would support. The idea of clinicians being greater, having greater involvement in commissioning and being more involved in how services are designed is a good idea. The problem is, you didn't need legislation to do that. If you'd have asked me, would I spend time on the PCT and think about how the money should be spent, I'd be more than happy to do it. I'd do it in my own time. There was no need for legislation. The bits that they needed legislation for were the bits which were wrong and the bits which are actually destroying the NHS. Firstly, the idea of competition. I mean, this bill was designed to increase competition into the NHS. It was designed to allow any qualified provider to provide stuff. And people could argue, well, what's wrong with that? I don't know how many people had the chance to watch the Panorama programme on Winterbourne View earlier this week. They talked to me. The independent report actually says that one of the reasons why stuff had gone on there and things had got worse was the fact that there was a profit motive behind this. It's inevitable. When you start having competition and you start looking at profits, quality of care goes down. There's a race to the bottom in care to just get things done. Staff morale gets affected and staff turn nasty. It's a true fact, and I think when they introduce competition, that's one of the things that I'm really scared of, that the NHS is going to get worse because of competition. I've been told I've got 5 minutes. We've already talked about the... I want to make one other point. I mean, the idea that they said that this competition is not about making the NHS worse and not about making businesses come in. Earl Howe actually said at the time of the legislation came out, this is a fantastic opportunity for business. They were his words. Virgin Healthcare, which was running those GP surgeries, where you needed 4 GPs, what they'll do is they'll give you 1 GP. You'll still have free healthcare. David Cameron's right there saying that it's not going to affect you because you can get free healthcare. Yes, you can get free healthcare, but you're going to have to wait for it for ages because they'll get locums in. They'll get people in who can do it for cheap, and you won't get the same quality. And then the bit that really kind of vexed me, and which I gave my money to 39 Degrees for, was to look at that was a campaigning group, was to look at the actual beginning of the legislation about the Secretary of State's responsibility for the NHS. When Bevan set up the NHS, the idea was that if a hospital, I think it was the exact quote was, if a hospital pan fell in a hospital ward, the reverberation should be heard at Whitehall. Now, if the trolleys in A&E at Queen's Medical Centre crash into each other, all that Jeremy Hunt would hear is deafening silence, because they've removed some of the mechanisms, and the Secretary of State has managed to distance himself from the NHS, and I don't think he has got responsibility. I think that's what he's going to end up doing. I'm going to go through the next bits, because I think they're important, so I might take a couple of minutes extra. These changes are impacting patient care. I know in my line of work, in mental health, someone's talked about suicides already. Suicides have gone up. Every year since 1997, and this is thanks to the Labour government, suicide rates fell every year since 1997, up till 2008, 2009, when the recession kicked in. And since then, suicide rates have been going up. Partly, I think, the recession, I agree with that, but partly because you're making so many cuts to the NHS, to the people who support people with difficulties, with mental health difficulties, and partly because of this benefit system and this kind of the people. I know so many people who've been admitted to my ward because they've been to ATOS, they've been told their benefits have been cut, they're distressed, they've never been admitted for years. And my colleagues who work in the trust with me will know this as well. They're having to come back into hospital because of it. The 4-hour wait, which was the bane of my life as a junior doctor, I hated that whole 4-hour thing because it did keep me on my toes. It made sure that everyone got seen within 4 hours. That slipped already. People are not getting seen within 4 hours in the A&E. And then also, if you look at waiting times, they're teetering on the brink already. The King's Fund, which is it's an independent charitable organisation, a think tank into healthcare. They've actually said, they actually did a survey of finance directors of the NHS Trust, and they said that things are going to get worse. Half of the finance directors in the NHS admitted things are going to get worse. The commissioning landscape has already been touched on. All I'm going to say is that we've got these clinical commissioning groups, but we've also got clinical networks, clinical senates, local health and wellbeing boards, Health Watch, the National Commissioning Board. It's such a complicated environment that no one really knows what's going on. The most recent fund, which is September 2012, says we desperately need clarity about how these organisations are going to interact with each other. We still don't have that. And I'm going to touch upon a topic which is very important to me and which I don't think got much thought even around the time when it was discussed in Parliament. First of all, it was a travesty that this bill only got a couple of days or whatever it got, and there was no proper time for debate. But training. The novelty of introducing myself as a consultant hasn't quite worn off yet. It's only been 2 years since I've been one. But I know how much training the NHS provided me. 15 years, medical school, then foundation years, then as an SHO, then as a registrar to get to this stage. And that training was provided by the NHS free. It was altruistic. Other people providing me training. I have 5 junior doctors of my own now who I train and 3 medical students. There's no budget for that. I just do it. And that training issue hasn't really been thought through, because what's going to happen with all these any qualified providers, private sector people, is they're not going to want to train people because there's no money in it for them. So what you're going to be left with is the NHS dealing with the most complicated patients and junior doctors having to deal with complex stuff, but never having seen the easy stuff, which is kind of like what you need to see in order to learn. Anna Soubry on her website, okay, you can boo. Anna Soubry, she talks about how cherry picking is not an issue because it just shows kind of the narrowness of the thinking. She says it's not an issue because we'll pay people less if they're doing the easier stuff. You've not got the point about training and how fundamental that is to the NHS. You can't divvy off part of it and just say that it doesn't matter, that's easy. I've got to make this point that Labour didn't get it all right either. There were some ideas within which I disagreed with. PFI, although it gave us some bright, sparkly hospitals, it has left trusts with big issues in terms of how they reorganise services now, because you can't get away from that mortgage that you need to pay. I was fortunate enough to be in a meeting with Ed Miliband, Andy Burnham and Diane Abbott at the start of the week on Monday, when Ed gave his first keynote speech on mental health, and it was the first speech after party conference, and he was absolutely brilliant. But one of the things that Andy said is that we will think about repeal and replace. The note that I have to sound is one of caution, because clinicians are tired, we're bored, and we're disengaged. We're seeing so much happening to us that it's just so difficult to keep pace with the changes that I think we need to be careful. And that brings me on to kind of Anna Soubry's views about presentation of reform. I saw an interesting clip in the papers actually about Andrew Mitchell, the guy who was sacked, the previous chief whip. Oh, not sacked, he resigned because, what was it, if you're not effing running the country, you're a pleb. I think was his view. He was actually told by some of his backbench MPs that Anna Soubry is a train wreck waiting to happen. My question is waiting. She said about these reforms that it was a screw-up. And then she tried to kind of get out of it, saying, well, what I meant was that the way that they were presented to the health professionals was a screw-up. She needs a little bit more learning. It wasn't the way they were presented. These reforms were a screw-up, is the truth. It's a backdoor to privatisation. And on her website, I don't know whether anyone's seen her website recently, she's got Mythbusters. It's a PDF of 24 myths that she thinks that we're making up about this bill. They're not. She's not busting any myths. It's manipulative use of the language is the only way that I can actually say what she's managed to do. And like Nick, I think what would be great is for Anna Soubry to actually debate some of the things that she's put on her website with a clinician. Because I can tell you, when she's faced with some practical examples of what those so-called myths are, then they will find that things will change. I am going to wrap up. I know I've gone over my time. I'm going to wrap up by coming back to the beginning and talking about how the NHS is more than just a system of care. It is a statement of our social solidarity. I know the people in this room will probably all share the same values that I do, that health is a fundamental human right. I was up at conference earlier this year, and I was so pleased that Ed had brought over Michael Sandel from Harvard, who talked about the moral limits of markets, because I think health is one of those things where when you introduce a market, you make things worse. It's not like choosing toothpaste. Most people don't actually want to have kind of lots and lots of different choices. They want to know that the doctors they see, the nurses they see, are people who don't have a profit motive, that they actually care about providing them health care. There are things that shouldn't be left to the market forces. I was so pleased when the Olympic ceremony, the Olympic openings, when they had the NHS little bit on. it made me feel quite warm, you know, that I felt recognised. It's the bit that I think it's part of Great Britain. It's part of our it's part of who we are, the NHS. And they talked about the Olympics being a once-in-a-generation thing. I hope that, you know, in the next generation, when we get the Olympics back to Britain, we'll still be having the NHS as part of our opening ceremony. I really do hope that. I'll stop there. Thank you very much.